You are listening to Realign Your Life podcast, where I discuss with you strategies on how to realign your life and move towards the direction you always want to. I am Vivian, the host of this podcast, and every week I will bring value on how to improve and realign your life either through a guest or my thoughts. I can't wait to share what we have this week. It's time to realign your life. Well, hello there, and welcome back to Realign Your Life podcast. This is Vivian, the host of this show, and I am so excited to have you join me for this episode. Well, Realign Your Life is all about making sure that we are empowering ourselves by taking care of ourselves. Self-care. Self-care is so important mentally, physically, spiritually, because that is what we are. Whole, one body, one soul, and one mind. And so recently, I want to share this with you because recently I was just at a memorial service for a very dear friend of mine. And when I got the news that she had transitioned, I was just in utter shock and disbelief. I'm like, really? This lady looked like the picture of health. She was so vibrant and just so enthusiastic about life. And we've been friends for, oh my gosh, well over 20 years. And so it was sad, but it's also a very important lesson for all of us. And so I want to share with you some thoughts on self-care and how we have to take ownership of that. We have to take ownership of taking care of ourselves in all aspects. So when I heard that my friend had transitioned, of course, the first thing that I wanted to do was to pick up the phone and speak to her daughter and just to check in on her and see how she was holding up. And as I spoke to her, she told me, she said, yeah, Mom really fought a good fight, but she had a massive heart attack. And the doctors did everything that they could for her to survive, but all of their efforts failed. So anyways, I go to the memorial service, and interesting enough, I met a friend that I'd known for a long, long time, but hadn't seen in a while. And she and this other friend that had transitioned lived in the same complex. And she was just sharing with me how she had seen her a couple of weeks ahead before, and that the friend just didn't look like herself, because normally she's very vibrant, very jubilant, very talkative, very engaging. And this particular day, she said she was just hanging on the chair of this other person, wasn't really talking to her or speaking to her, and just wasn't her usual self. She said she knew that there was something different. And so I say this to you guys out there. When you see something, say something. Ask that person, how are you doing? How are you getting along? You just don't seem like your normal self today. Is there something going on? You have something going on? And sometimes that will prompt that person to speak up, or for you to say something that could be encouraging or could be life-saving. So I want to take this time to remind every woman out there the importance of self-care, and men also, and the importance of having an annual physical examination. That is so important. Don't be afraid to speak up and to be an advocate for yourself. That's what you're paying them for, okay? And if you're like me, I can't always remember everything. So every time I think of something that I want to share with my physician, I put it in a note. I put it on that. Actually, there are notes in your calendar or on your calendar, and I put it on there the day that I am to see the doctor so that I won't forget. And I tell you, it could be life-saving for you or for someone else. So I just share with you, and I'm speaking to myself also. Stop procrastinating because it may cost you your life and agony for those that love you. A heart attack is a life-threatening episode. It is a medical emergency that requires immediate attention. A heart attack is also known as a myocardial infarction, and it occurs when the flow of blood that brings oxygen to the heart muscle is impeded or it suddenly becomes blocked. Your heart can't get enough oxygen if the blood flow is not returned immediately, and that muscle will begin to die. And just know that a heart attack can occur at any age. It is not discriminatory. Both men and women who have heart attacks have chest pains. In addition to chest pain, women can have some additional aches and pains also. They can have pain in the shoulder or arm or neck, in the jaw, shortness of breath, anxiety, an upset stomach, unusual fatigue and weakness, and you're just tired and you just can't put your hand on it. These symptoms can happen with or without chest pain. And according to the American Heart Association, symptoms of a heart attack can come in stages. So when I think about what the one friend was telling me about how our friend that transitioned, how she was acting and how she was feeling that particular day, I'm thinking this could have been some of the stages that was really happening to her at that time. And just for your information, these stages may include chest pain or discomfort, signs of indigestion, but indigestion will go away. If it's a heart attack, the pain gets worse. Anxiety or panic, or you can break out in a cold sweat, and that cold sweat can emulate those symptoms like when you have a flu or any other viral infection, shortness of breath, dizziness, or lightheadedness. So see, these are some of the symptoms that can come on, and they can come on in stages and not necessarily happen all at once. And so for many of us women, we may try to downplay these symptoms and not seek immediate help. And sometimes even when you go to the emergency room, it may not show or detect the early signs of a heart attack. And so we just downplay it and dismiss it and do not follow up, even though the symptoms may persist. And because of this, women often have and are at a higher risk for serious health problems following a heart attack. But just know this. If you or someone that you know is suffering a heart attack, the most immediate thing that you need to do is to dial 911. Do not try to drive yourself to the hospital or drive someone to the hospital. Make sure you call 911. Remember, acting fast can save your life. And remember, the longer that the heart is without oxygen, the more damage that is happening to that heart muscle. However, do know that many people live a full life after a heart attack. And when I think about heart disease and women of color, it is really a significant health issue. Black women face some unique challenges and disparities in cardiovascular health compared to those of other populations. And I just want to share a few key points about heart disease in Black women. First is prevalence and impact. Higher risk. Number one is higher risk. Black women are at a higher risk of developing heart disease compared to their white counterparts. The prevalence of hypertension, a major risk factor in heart disease, is particularly high in women of color. Underdiagnosis and treatment. Black women are often underdiagnosed and undertreated for heart disease. And this can be contributed to a combination of health disparities, socioeconomic factors, and lack of access to quality health care. Those are two of the prevalent factors that impact Black women and healthcare. And some of the risk factors that Black women have are hypertension, as I mentioned earlier. Black women have the highest rate of hypertension in the U.S. And of course, high blood pressure increases the risk of heart attack and stroke. Secondly, obesity. Higher rates of obesity in Black women contribute to heart disease. Again, socioeconomic factors, the lack of access to healthy foods, living in food deserts, and of course, there are cultural influences on diet and exercise also play significant roles. Diabetes. Diabetes is prevalent in Black women and at a high risk for heart disease. Socioeconomic factors. Lower socioeconomic status and limited access to health care contribute to the disparities for heart disease and the impact of the outcome that it has in the lives of Black women. Stress. Oh my goodness. Chronic stress, which is often related to experiences of discrimination and socioeconomic challenges. And of course, we know that stress can really lead and impact cardiovascular health. So these are some of the risk factors that we face as women of color. And I just cannot stress enough the importance of self-care and taking care of yourself, making sure that you're getting plenty of sleep and exercise, and that you are getting those physical exams. And if you know another sister that needs this information, please share it with us, because knowledge is power. And at the memorial service, my friend's daughter spoke, and one of the things that she said is that I will pay it forward. I will let everybody that I know the importance of having a physical exam and taking care of themselves. I don't know if her mom had been exhibiting these symptoms or not, but usually it doesn't come on that suddenly. There is something always in the backstory that has happened or that is happening. Sometimes we aren't aware. And that's why it's so important. I mean, we've seen young men, young, healthy men suffer cardiac arrest, but cardiac arrest and heart attack are not the same thing. But cardiac arrest can lead to a heart attack. So just make sure that you're taking care of yourself. I am going to I would suggest that you would go back and listen to a couple of earlier podcasts. I think it's podcast 27, maybe 29 and 30, where we had Dr. Willie Mae Abel on, and she talked about blood pressure in women of color and how to be an advocate for yourself. So I would suggest to you that you would go back and listen to those episodes. They've had lots of wonderful information in there. I will come back on another episode later because there are a couple of other things that I would like to share with you about this subject matter. I think it's so important for us, really. If we are realigning our lives, this is part of it, is being advocates for ourselves and reaching back or reaching across the aisle to help someone else also. The life you save may be your own, or it could possibly be a life of someone that you love. So in conclusion, my friends, addressing heart disease in Black women really requires a multifaceted approach. It includes, incorporating some preventive measures, including awareness, knowing your numbers. Where are you? And what are you doing? And making sure that you have access to quality health care. Speak up for yourself. Be an advocate. And if you feel like you can't understand all of those big words that doctor is using, take somebody with you, or you make sure that you tell them to break it down to everyday language. Well, my friends, I want to thank you for joining me for this episode. I look forward to the next one. And as always, I will say to you, take care as you are realigning your life on this wonderful journey. And as always, peace. I hope you enjoyed this episode. The best gift that you could give me is to share this podcast with family and friends. And don't forget to review it. That way, this podcast will grow organically. If you need to reach out to me, please check out my Facebook page, DM me there, or you can email me at godskow@gmail.com. We have upcoming Bible studies that we would love for you to join us in, or if there is a guest or someone that you would like to see me interview on this podcast, please let me know. We are here to work together to realign our lives. Until the next episode, take care, and I look forward to sharing more and more with you as we realign our lives. Peace until next week.